Okay. This is your physical assessment that you're going to do on every ICU patient, head to toe. And remember, if they have a particular diagnosis with a system, you're going to do more assessment on that system, but we'll learn about that as we go through the systems. So to begin, we're going to walk in the room. Good morning.
Morning.
So she's awake and she's alert. Can you tell me your full name?
Sarah Tonin.
Okay, Miss Tonin, do you know what day it is?
August the 26th-ish.
Good. You know what year?
2016.
Very good. Do you know where you are?
At the hospital.
At the hospital. Do you know why you're here?
I'm sick.
Okay, very good. So she's oriented ×4. I'm going to check your pupils for their reaction to light. So I'm going to shine a light into your eye. So just look straight ahead if you can, and I'm going to shine a light. Good constriction on that eye. Good constriction on the other eye. And then I'm going to come around. Same thing. Good constriction on that eye. Good constriction on the other eye. So her pupils are equal, round, and reactive to light. I am now going to check your grips. Are you right-handed or left-handed? Right-handed, okay. So I'm going to put my right hand in her right hand. I'm going to have you squeeze as hard as you can. Very nice.
Thank you.
I'm going to give you a 4 out of 5 on muscle strength for your grips. I'm going to have you push against my hands with your feet. Oh, very nice. And pull. Okay, so I'm going to give her a 5 out of 5 on her lower extremity strength. Next, I'm going to look at her skin. And I'm feeling it. It's warm, it's dry, it's pink. Her color is appropriate for her ethnicity. Then we're going to look at her respirations. They are non-labored. Her respiratory rate.
I like that watch.
Is 14. Now I'm going to listen to her lung sounds. And I'm going to snake this up here, and I'm going to get it as far under her as I can. Take a deep breath. Good. And again. One more time. We have some crackles there. Then I'm going to come over here. Big breath. Nice and clear. Very nice. Okay, good, clear breath sounds. Then I'm going to listen to her heart tones, moving to the cardiac assessment. Loved up, loved up, loved up. S1, S2. I'm going to feel her radial pulses. Nice and strong. 3+ out of 4+. I'm going to feel her dorsalis pedis pulses on top of her feet. 1+ out of 4+. I'm going to feel her posterior tibials. Also probably 1+ out of 4+. Okay, now I'm going to do capillary refill because that's part of the cardiac assessment. Capillary refill is less than 3 seconds. Abdomen, moving to the abdomen. I'm going to inspect. It's flat, soft. I'm going to listen to bowel sounds. Ooh, ooh.
Impressive.
Whoa.
Wow. Kim's hungry.
Sarah's hungry.
Sarah's hungry.
Serotonin's hungry. All right. Tonin has normal active bowel sounds. Now I'm going to palpate, and I'm going to be feeling for any masses, watching for any signs of tenderness. So you let me know if this hurts in any way. Okay, her abdomen is soft, non-tender, no masses, no guarding. Very good. The genitourinary, if she has a Foley catheter, I'm going to note that she has a Foley to gravity drainage. I'm going to look at the urine, and I'm going to document the color and the consistency of that. If she has a fecal management system in, I'm going to look at the stool, and I'm going to document the color and the consistency of that. For the renal assessment, that's all about fluid. So I'm going to look at her mucous membranes, and I'm just going to look around her conjunctiva and see they're nice and moist. I'm going to check her skin turgor right here on her sternum. So I'm going to pinch some skin, and her skin turgor is elastic. I would then go to the chart, and I would note the 24-hour INO and her daily weight. That all together is going to tell me about her fluid volume status. Then I'm going to look at her extremities and just note any wounds, if she has a wound vac on anything, if she has IVs on her extremities, anything like that. I'm going to note what the skin looks like. I would have some help in here, and I would roll her over. I would look at her posterior, and I would note any wounds or skin issues that she has with that. Then the final part of the physical assessment is any piece of equipment that is hooked on her. So starting at her feet, they're probably going to have scuds or sequential compression devices on their legs. They are probably going to have an IV located up here in the external jugular. And they're probably they might have a chest tube, so you would note what the skin incision looks like and what the drainage looks like. They may also have an ET tube. And when we talk about the pulmonary system, we'll talk more about what documentation you need for the pulmonary. But if she has an ET tube, I would note that. If she's on a mechanical ventilator, I would note that. If they were on a balloon pump, I would look at the insertion site, I would document that, and then I would note that they were on the balloon pump. So anything that's connected to the patient would be noted in the final documentation. Any questions? Thank you, Miss Serotonin. All right, guys, there you go.